Thank you so much to the organizers of this event. I think this is a very timely topic that we all need to be, you can put on the next slide, that we all really need to be aware of and start really thinking about. So, give me one moment. So I will say I have no conflicts of interest to declare, and I am on the faculty at UNC, but I'm not speaking. My views that I'm expressing here today are all my own. Where I want to start is, you can go to the next slide, is today I'm going to be talking about these crisis pregnancy centers, which I know if you're here, you probably have some awareness of what these are. They go by a couple different names. Some people will call them unregulated pregnancy centers, fake clinics. They also go by pregnancy support centers, pregnancy resource centers. So I hope today that we can kind of define what CPCs are. You'll understand why I, as an abortion provider, am talking about them, and also, most importantly, why you should care about this. So the other day, I was driving to my job as an abortion provider at Planned Parenthood in Roanoke, Virginia, which is where we have to go now because of the laws in North Carolina have really restricted what we're able to do and how we can train people here in North Carolina. So I was on my way there, and right outside the, next slide, right outside the clinic where I go to in Roanoke, I passed several protesters and a billboard that looked something like this. If you've taken the abortion pill, it might not be too late to change your mind. And this is a reference to the idea that abortion can be reversed. And this is a very common trope in the anti-abortion world. And it's something that these crisis pregnancy centers really like to hone in on. So once I got inside, one of the healthcare assistants brought me an ultrasound picture. And it was actually a whole list of these same exact picture that just said, baby, 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 baby. And I don't know what you know about healthcare, but basically the patient didn't understand why I couldn't just use this ultrasound to be able to provide her with the abortion, that I preferred to have an official ultrasound that actually gave us measurements, the gestational age of the pregnancy, showed me exactly where the pregnancy was in the body and things like that. But there was no actual information like that because it was pretty clear what this crisis pregnancy center that she had gone to was trying to convey. Next slide. Baby. That was it. So next slide. So where had this patient gone to get this ultrasound? She'd gone to one of these centers that advertises free ultrasounds, free pregnancy tests, other types of things. So crisis pregnancy centers are organizations that seek to intercept women with unintended pregnancies who might be considering abortion. Their mission is to prevent abortions by persuading women that adoption or parenting is a better option. And they strive to give the impression, though, that they are actual medical clinics. They try to give the impression that they're offering legitimate medical advice, that but the truth is that they're exempt from regulatory licensure and credentialing oversight that actually do apply to real clinics. So they kind of get around this through First Amendment rights. They can say whatever they want, but they tend to really mislead people in this very insidious way that allows them to think they're actually getting some real medical advice when it not, in fact, is not. Next slide, many of the CPCs they'll set themselves up like this. They'll offer free pregnancy tests, they'll offer limited ultrasound, STI testing, sexually transmitted infection testing, abortion counseling or abortion options, maternity clothes, diapers, sometimes parenting classes, abstinence-only classes. And what's not super clear, though, from these centers is that they're really very often motivated by religious ideology. So that religious ideology actually takes precedence over the well-being of the patients that are going to see them. Women there don't receive the comprehensive, accurate, evidence-based clinical information that should be available to them. Next slide. So I first became aware of these centers early in my career when I was on the board of NARAL, what was then called NARAL Pro-Choice North Carolina, and it put out a document that revealed all of the deceptive practices of CPCs. So in 2010, North Carolina passed its first Woman's Right to Know Act, which was this act that caused us to have a lot more regulations around abortion clinics. We had to do ultrasounds for patients. We had to do a 24-hour waiting period prior to an abortion. And we had to go through this consent with patients. And this is what really got me. So the next page. So this one is from the latest consent that we still have to do for patients. But we actually had to tell people as part of the counseling that, they had to say, I understand that I may view the fetuses by ultrasound and or listen to fetal heart tones if present prior to the procedure. I understand that printed information is available to me about the locations to receive a free ultrasound. So we actually have to alert patients to the presence of these crisis pregnancy centers through this counseling that we have to do prior to an abortion. So next page. So this is the resource directory. It's available online. It's still there. Go to the next page. So it does actually list legitimate places like health center, even abortion clinics. It also lists county health departments, local DSS services and such, but it also lists, you can click to the next slide, all these different pregnancy centers. And if you go through this booklet, you'll see that pretty much every single county has a crisis pregnancy center. So next page. So, and this is where they're directing people. They have websites that you can click onto, and this is where you'll get. So next slide. So North Carolina has about 14 to 16 abortion clinics right now. And they're mostly in these areas that are shown there. And next slide, it has a whole lot more crisis pregnancy centers, about 100. So at least one per county. Next slide. So why should you care? So let's talk about how CPCs endanger public health. And I would argue that they do this in pretty much 4 key ways. One is that they cause delays in care. So this can be either a delay in getting to an abortion clinic or a delay in getting into legitimate prenatal care. I had a patient once who came to a clinic who'd gone to a CPC. She knew what she was getting into. She went to get an ultrasound. What she did not expect was that she would be there for 3 hours while they did an ultrasound, went through counseling, talked to her about religion. And she was really distressed by this experience that she'd had. And she didn't come to get her abortion until a couple weeks later. So we know that these places cause delays in care and that is a real problem. They also tend to overstate the risk of miscarriage for patients. So they'll help make patients think that they're gonna have a miscarriage anyway. So why bother going for prenatal care or going for, or seeking your abortion, because naturally you'll probably, sometimes as much as 30% of pregnancies may end in a miscarriage or something. They'll say that, even though once you've reached a certain point of pregnancy, the risk of miscarriage goes down considerably. Also, they will give, sometimes the really scary thing is that they could miss really important diagnoses. There are many more people today who have various types of ectopics. There are C-section cesarean scar ectopics, which can be very dangerous to people. And these are not diagnostic ultrasounds that can detect that easily. They also can't detect just normal tubal ectopics very well. So people could potentially, next slide, I didn't realize. So they're giving these unclear, unmarked ultrasounds and not necessarily having correct diagnoses either. Next slide. So another key way that they cause problems is by spreading misinformation. So CPCs contribute to this wider misinformation ecosystem by perpetuating myths about abortion and debunked claims about the risks of abortions, as well as touting the availability of something called abortion reversal, which is where they claim that giving somebody a medicine, a progestin pill, after taking the mifepristone or the abortion pill can reverse an abortion. Small studies that have been done have actually shown that this can be quite harmful, and so it's certainly not proven to be effective or safe. So this is really a problematic area where these CPCs are really spreading a lot of misinformation. Next slide. So in a few studies that I conducted a few years ago, we found that centers both in person and on the phone and in their websites were spreading a lot of very insidious disinformation that is just ubiquitous across these websites, and this is still true today, that they'd say that abortion causes breast cancer and infertility, increases the risk of eating disorders and suicide, and that they have extreme risks that are absolutely not true. We know that abortion is one of the safest medical procedures that is done today. It is extremely safe, and the earlier it's done in pregnancy, the safer it is. But they spend a lot of time trying to convince patients that abortion is very dangerous. And they also spread misinformation about birth control and condoms and say that they're ineffective and things like that, which is also not helpful. So, you can go to the next page. So the third way these centers are extremely problematic is that they lack the normal regulation that health clinics have that are required to have to protect patients' privacy. And so by operating outside of these regulatory structures, they don't have to comply with HIPAA. They collect patients' data. They will sometimes mislead them and say we're taking your patient health information instead of protected health information, things like that, so that they can get away with collecting people's data and then putting it into centralized databases that go who knows where. And you may recall from Project 2025 that there is this push in Project 2025 to put people's health data into a nationalized pregnancy registry where the federal government can know if you're pregnant or not. And I think what's really problematic about this, not only that, but also that patients just don't understand that this is what's happening. It's very deceptive. They think that they are going to a confidential medical center and going to receive legitimate care, and instead they may be, somebody may be calling them a couple weeks later to find out if they had an abortion or if they had, or what happened to their pregnancy. Okay, next slide. And finally, by design, these centers target what they call abortion-minded patients. So in addition to trying to dissuade people from, or discourage them from getting abortions and scaring them about the risks of abortions and giving them a false sense of security in terms of their confidentiality, they're also targeting people who are the most vulnerable. So people who may have trouble navigating the health system, who live in poverty, who are in most need of material assistance. There are some studies showing that people will go to these centers mainly because they need diapers or they need maternity care, maternity clothes and things like that. And they will sometimes promise things like that. Next stage, but we did a study a few years ago showing that, the other flip side of that and the way they target the most vulnerable is that they really try to deceive people, and there are people with lower health literacy, lower means to get around who will mistake these centers for legitimate health centers. So in this study that we did, we showed that people were not really able to identify a crisis pregnancy center versus an abortion center. A legitimate healthcare center. So more about why you should care. So one, these places are really not a good use of taxpayer money. They get a lot of private funding, but many of these places also get a huge amount of state funding, and they have no accountability whatsoever. There's just not mechanisms in place for these places to be held accountable for all the money that they receive. This one study, and this is from Reproductive Health Freedom Watch, this one study looked at, did a little case study of some places in Indiana. They showed that this unregulated pregnancy clinic, there were 3 of them, altogether, all they did was give pregnancy tests, which, by the way, are the same pregnancy tests you can buy in a dollar store. They did some non-diagnostic limited ultrasound, pregnancy options consultation, STI testing, and parenting classes. And their cost per patient was $674 for all the patients that they served. In contrast, this nonprofit free clinic in Indiana was able to offer a huge number of actual health services. In addition to pregnancy tests, also mammograms, pap testing, dermatology, wellness exams, asthma and allergy, pediatrics, everything you might need in a comprehensive health clinic. And they were able to do so at a far more affordable cost of just $182 per person. So we should really understand that these centers, despite how they are sometimes touted or posited as legitimate alternatives to the really terrible maternity deserts that we have here in North Carolina, they simply are not. They are not equipped to provide prenatal care, to provide legitimate health care in a way that can serve patients' needs. And then finally, I think it's really important to recognize that these centers are part of a broader, coordinated agenda to shape culture and policy through restricted reproductive autonomy and reinforced gender roles and reduced civil rights. And so I think it is incredibly important for people to have awareness about what these centers are doing, how they operate, and what we can do to try to promote actual healthcare centers that will give people regulated and legitimate healthcare and protect people from these centers that prey on them. Thank you. I'll take questions afterwards.